I commend the motion to the House.
Barbara Stewart.
Thank you, Mr Speaker. I'm very pleased to rise on behalf of New Zealand First to speak to this report. First, I have to congratulate all of the members of the Health Select Committee for the substantial report that we wrote under the excellent leadership and chairmanship of Dr Paul Hutchinson, who I must say spent many hours ensuring that the committee was on track, encouraging the committee to review the submissions, keep to the topic, and ensuring that the recommendations that we were making were as realistic as they possibly could be and as perfect as they possibly could be. So thank you, Dr Hutchinson, for your patience in that area. Also, we have to give thanks to the Select Committee staff for their tireless work on this massive project. Thank you to the submitters, the advisors, and the many others who willingly and passionately gave of their time to ensure that the recommendations are achievable and realistic. It has been great to see a Health Select Committee report acclaimed by so many organisations, so many people, including editorials in various publications. The fact that there was general consensus within the committee shows that we wanted the best for New Zealand children, regardless of our political affiliations. This report should provide a signpost for many years to come. We know that it is very important to invest in the early years, and of course there have been very few reports written for this age group. The goal must be to ensure that every child should have the opportunity to reach their full potential. A good start in life should pay dividends when school age is reached, and on further. I'm reminded of the words of my former late colleague Brian Donnelly, who always used to say on a regular basis, the quality of the children we leave for the future determines the quality of that future. And this is an instance where it is absolutely accurate. One of the areas that I'm very passionate about is oral health, and I will always stand up in that area. I know that poor oral health affects learning, self-esteem, development and overall well-being. It's one of those diseases that is chronic here in New Zealand, and unfortunately or fortunately it is one of the most preventable in all age groups. Nothing is sadder than seeing the struggle that a child has when they go to school trying to learn to read with no teeth. Difficult to participate in classroom activities. Communication is very, very difficult, and it genuinely results in a degree of isolation from their peers, and no child should have that. The 11 recommendations that we made in the oral health section are achievable without a huge financial input by the government. One of the issues that divides the community is the issue of the fluoridation of water. We have traversed that in this particular report and come up with some recommendations that hopefully the government will ensure come into being. The ongoing monitoring of children who miss scheduled dental appointments is really necessary, as this hard-to-reach group cannot be allowed to continue to slip through the cracks. Some administrative factors, such as defining dental neglect so that it can be managed accordingly, and further defining ethnicity in that category of other children, is absolutely essential to identify any groups that are at risk. In this section, we attempted to ensure that the recommendations, once implemented, would significantly reduce the risk factors associated with children's oral health and dental caries. Our dental therapists do a massive job, often under difficult circumstances, and we hope that this section assures them that Parliament is keen to support their hard work that they do. I look forward to the government's response to the recommendations.
Paul Foster-Bell.